Welcome to Kidney Cancer Unfiltered. I'm your host, Anna Maria Scaccia. In this episode, we're talking with Raul Chavez, an 18-year kidney cancer survivor. Raul shares the emotional toll of living scan to scan, the PTSD he experienced after his diagnosis, and how he's learned to navigate life as a long-term survivor. For full transparency, Raul is a dear friend, one who constantly inspires me. In our conversation, he shows what it means to thrive beyond cancer, and I hope you find his story inspiring too. Thanks for joining us. Let's get into it. Well, thank you, Raul, for joining me. For the listeners who may not be familiar with you, can you introduce yourself and your story?
Yeah, thank you, Anna Maria. My name is Raul, and I am an 18-year now kidney cancer survivor. I celebrated my 18 years of survivorship last week, actually, on July 17th. I was 23 years old when I had my surgery and was diagnosed with stage 1.5 renal cell carcinoma. 1.5, I know it's strange, but my doctors acknowledged that although I was still in stage 1, the tumor in my kidney was already moving away from the kidney and going into stage 2. So they decided to be clever and go with 1.5. Would you like me to share how that came about?
Yeah, that would be lovely. I was going to say, though, in the 2 years that we have known each other, I have never asked, and I probably should have, what stage, because I would have wanted to have a discussion as to why you were labeled stage 1.5, because that is a new one for me. But go on, how that is one thing. How did you discover that you had kidney cancer?
Yeah, so it's actually one of those quite bizarre stories, and that it happened mostly by happenstance. I was 21 years old when I was still living in college, and I would visit my family on the weekends in Southern California. And my mom was always very good about making sure that we had our annual checkups. So I went to my local doctor where I grew up in Southern California, a very low income area, with doctors serving a lot of types of, a diverse set of patients, mostly non-English speaking. And my doctor noticed that my blood pressure was unusually high. I don't remember the exact readings, but I remember it being really high. He thought that it was just white coat syndrome and didn't make a big deal out of it. So he did have me come in a week later to see the nurse just to have my blood pressure taken, thinking that if you don't have an appointment with me, the pediatrician, it was still a pediatrician actually, then your blood pressure should be back to, should be normal. I did go in once the following week and it was still unusually high. And then nothing happened after that. There was no follow-up at all. My doctor dismissed it as, you're fine, you have no other symptoms. Fast forward a year and a half later, I'm 23 years old. I'm living in Boston. I'm working for the federal government and I had really good insurance. And of course, remembering that my mom instilling this, get your checkups every year into me, I went in for a checkup in the Back Bay in Boston. I still remember the office and the doctor's name, Dr. Fenton. And he also found my blood pressure to be really high. And he also said, like, you're probably just nervous. It's probably nothing. You're young, you're healthy, you have no other symptoms. And I was already literally walking out the door after the appointment was done when he said, you know what, let's just do a couple of tests. Maybe your ureters are narrowed and we have to put in some stents and that's affecting your blood pressure. Maybe it's something like that. So I did go for the tests. A part of me was thinking this is just a waste of time. I'm young, I'm healthy, I don't have any symptoms. But I went in for a CT scan. And then I went in to get my results about a week later. And I still remember my walk from the subway station in Boston to the doctor's office. I was on the phone making plans with friends for that evening. Did not have anything on my mind whatsoever, no sense of fear or concern or anything about this. And I go into the office, and it was an intern who saw me, not my doctor, not Dr. Fenton. And the intern comes over with some papers in his hand, and it's the results of the CT scan. And he shares with me that I have a lesion in my right kidney. And in that instant, just given how he was sharing the information, I could sense that something was wrong. And I
Mm.
didn't know yet what it was. So I went into this mode of where I zoned out and I'm half listening to what he's saying, half in my head wondering what is wrong. I like kind of like already sensing that fight or flight response. And I keep thinking lesion. To me, that means some kind of wound, some kind of cut. How does that happen inside my kidney? I don't understand. And as I'm half listening, half wondering to myself, what is happening here? Something is about to happen. He uses the word tumor instead of lesion, and the size of a golf ball. And then that's when I have the out of body experience where I can see myself. Even now, I can see myself looking down on myself, sitting on the table, and him standing next to me, and talking about biopsy or no biopsy. And over 90% of kidney tumors end up being cancerous anyway. And we need to run more tests and see what this is. And so that was in April of 2006. And I had my surgery. I went into a series of tests after that, and I had my surgery on July 17th. It was completely removed because the tumor was right in the middle of my kidney. And I was diagnosed officially a week later with stage 1, or really 1.5, um, in renal cell carcinoma. It was a high grade tumor, which was made explicit to me. Um, and for that reason, after that, it was a series of going in every 3 months for scans and tests to make sure that my remaining kidney, my left kidney, was still okay. So I spent the following 5 years after that, most of my 20s, going in and out every 3 months and then every 6 months eventually to get these scans and wondering if I was going to be okay.
Yeah. And thank you for sharing that. But I want to, for me, for you, for the listeners, you have been cancer free for 18 years, right?
I have been, yes. I celebrated my 18 years last week on July 17th.
I love that. I'm so grateful that you have been. But we've talked a lot. So for the people who are listening, Raul and I know each other because he actually found me via one of my articles on the KCA's website about bodybuilding with one kidney. And I still remember your comment. I don't remember it verbatim because my memory is not good, but I remember you writing in your comment that it had made you cry because you were like spending so long trying to find a way to build muscle, and find some direction, and you hadn't. And please correct me if I'm wrong because I told you my memory is terrible. But that you hadn't found any guidance before this like one article, and that's kind of how we connected. And you first were my client and now we're close friends. But often throughout the time that we known each other, we talked often about like long-term survivorship. And I wanted you um, to start with some of the maybe misconceptions of long-term survivorship. I know I'm only going on 4 years into at least the kidney cancer journey. But I still hear, I hear now, even in 4 years, that there's some point where you're supposed to be just okay and like not really worried about it and like you should be over it kind of thing. So I'd love for you to talk more about what the last 18 years have been like for you as a survivor.
Yeah, so I know I've been thinking about this because when you're going through it, you're completely in survival mode. You can think of, depending on how often my scans were at the beginning, they were every 3 months. So I would take my life in 3 month periods. And it would really feel for me in those first 5 years. We always hear about those first 5 years are really critical. I was given a 90% survival rate
Yeah.
at when I was diagnosed. That there was a 90% chance that I would still be alive 5 years from diagnosis. And so you have that marker. I had that marker in my mind already of 5 years. I think from what I understand, most cancer patients do. But the fact that something like that is even being put over you is interesting to me. It's almost like, what are the odds that, I don't know, that England is going to win the Euro Cup, right? Like, but putting it on your life, which is a really heavy burden to carry. And even though it was 90%, you think, yeah, that sounds pretty good. But think about reaching into a bag with 10 balls, and one of them is white, 9 of them are blue. And if I take the white one out, then that means that you're not going to be alive in 5 years. And so those first 5 years, I really, for me, were years of survival mode entirely. At first, I went in every 3 months, and I really saw it as every time I would go in, I would see it as I'm going in to see if I can get a new lease on life. Am I going to get a new lease on life? Am I going to get a new 3 months, or am I going to be told that something is wrong, that something is happening? And I should also mention that my subtype of renal cell carcinoma was unclassifiable, and
Mm.
under 1% of RCC tumors are unclassifiable. The subtype is not classifiable. So I had a relatively rare cancer and a very rare subtype of that cancer at an incredibly unusually rare age. And my urologist actually wrote up an article and talked about my case at a conference of urologists because it was so unusual for me to be so young. And so for me, none of that made sense. So those five years were really nothing makes sense. No one can explain to me why this happened. It was not a childhood tumor. They ran tests on that to see if it was one of those childhood tumors. It was not, genetically speaking. And so no one could explain to me why it happened. And therefore, no one could tell me that my left kidney, which is made up of the same cells as my right kidney, what was it that was keeping that kidney safe? No one, like, if my right kidney with its kidney cells developed cancer, what was stopping my left one from doing so? And in those first 5 years, I had a number of scares. One happened actually within a year and a half of diagnosis, where I went in for my scans. I was only about a year and a half out from the initial diagnosis, and I went in for my scans, and I was waiting for results when I had a voicemail on my phone, and it was my urologist telling me that that my scans were showing a tumor in my left kidney, and that
Mm.
I needed to go in for more scans. So I went in for more scans, and then I did the usual wait of 3 days or so because they don't give you anything right away, which is
Mm-hmm.
really, really painful, really, really painful. And for 3 days, I did not leave my room. I still remember being in the CT scan and hearing the radiologists talking to each other every now and then in that half a second or 1 second before they stop touching the button so that I can hear them when they're asking me to breathe in and breathe out. And at one point, one of them said, "There it is," as they were asking me to breathe in. And in my mind, that meant that they had found the tumor in the scan, and that's what they were looking for. So I was convinced, completely convinced, that I had a tumor in my kidney, and I was just waiting to be told. I had been placed in front of a path with two different pathways. One of them was really dark with no potential exit that I could see, possibly, and one of them was I'm going to be okay, and that one was seeming less and less and less likely. And I went in after the 3 days, after being in my apartment on my own, without leaving my apartment, without doing anything, sure that I was about to go on this very, very dark journey. And I was told that it was just an imaging error. And so, of course, there's a lot of relief that comes from
Mm-hmm.
that, but there was a lot of anguish. There's a lot of anxiety, there's a lot of uncertainty, there's a lot of fear that just imbues all of life when you're waiting just to get results. And I've actually have said in the past that if I had never seen a doctor after my surgery, in some ways, mentally and emotionally, I might be better off than going in so regularly for these checks and wondering every time and being told. And so those first 5 years really were being in survival mode. Once I reached that 5 year milestone that everybody, of course, hopes to reach, it didn't get better for me. And I would say that the reason why is because I hadn't taken stock of the trauma that I had experienced. It had gotten to a point of PTSD. This is only,
Mm-hmm.
in the last 3 years when I've actually saw a therapist and revisited this time with her. And I shared with her my symptoms and what I was going through at that time related to the cancer. And she said, "Well, it sounds like PTSD." Because even seeing the word cancer on TV or on a bus
Mm-hmm.
going by would trigger me. Like I would feel my heart rate go up. Um, and so those first 5 years, yes, I had cleared a milestone, but I was still I was now going through the experience of PTSD and having those triggers. And I had another scare around that time as well that was very similar to that first one. Um, and so to me, it was still being caught in this cycle of, living my life in one check at a time, one scan at a time. And to make a long story short, I would say that even when I reach the 10-mile mark, doctors have a way of giving you good news when they have good news, but also kind of like adding in not bad news, but also like smacking you with the reality when they share these good news. So the number of times that my doctors have said to me, renal cell carcinoma is notorious for coming back even after 10 years. And since you've had cancer before, then your odds of getting cancer in the future are higher than the average person.
Mm-hmm.
And the life expectancy rate for a cancer survivor is lower than for the average person. And so even when you're getting good news from doctors, they always feel the need to remind you of these things that you already know because you've heard them before,
Mm-hmm.
that no matter how good the news are, they always caveat it with something, but you can't breathe easy still. And so even it wasn't until the 15-year mark, I would say, that it really began to change for me. And what happened is that I saw a different urologist because of the pandemic. I moved around. And this urologist, for the very first time, at 15 years getting my scans and everything was fine, he put his hand on my shoulder. He looked at me in the eyes and he said, Raul, you don't have to worry about this anymore. You're cured. There was no caveat, there was no qualification, there was no but in his statements. And I felt a release and a weight off my shoulder that I had never felt before. Because again, and even though I had those caveats and that information back of my mind, just hearing those words from a doctor gave me a release that I had not experienced before.
Yeah.
And it's been in the last 3 years, so years 15 through 18. Also, of course, adding in therapy to work out this trauma that I've experienced for so long, that I can actually now go to a test, go to a scan, my last one this year and then my one from last year, without feeling like the other shoe is about to drop. And so it took
Yeah.
me a very, very long time. And I remember telling you, Anna Marie, after my last ones in April, telling you, if no one told me when I was 23 years old that 18 years later, I would still be going through this
Yeah.
process of scans. I would still be going through reliving that trauma. I had my scans in April of this year, this time in London, and I went to a private hospital with a great service. And I wasn't expecting when I went in, I was just expecting to see the doctor for an initial consult and to establish care with him, with a urologist. And he said, do you want to just get your scan done now? And for about 5 seconds, I considered saying no because I had not put on my armor that morning
Yeah.
that I usually have to put on to go into the tube, to go into a scan, to put on the robe that I hate putting on.
Mm-hmm.
I said yes, and I waited in the waiting room for a little bit, and I sat there, and I still had a moment of where I cried. I didn't cry out of fear. I didn't cry out of feeling like something's about to happen. I wasn't survival mode anymore, but I cried out of feeling the weight of the last 18 years all at once as I'm about to go for another scan, and how much I've done this, how I've lost count of how many appointments I've had, how many scans I've had, how many urologists I've had. I've lost count of all these things because it's just defined my life so much, almost half of my life at this point. And when I put on the robe, I cried as well. And of course, everything is fine and relieved and grateful and all of that. But there's a weight that lessens, but you have moments where you really feel it again. It's kind of like
Yeah.
this cloud. It's this cloud. Once I was diagnosed with cancer, it's like this cloud. It's like someone put a film over my life that changed the tinge of my life. And it imbued everything. And sometimes that color, that tinge is really dark and ominous and scary. Like early on when I was going for scans, and sometimes it's not so bad, right? You forget it for
Yeah.
a little while between scans. But and over the last few years, I have to say, finally, thankfully, has that tinge started to really lessen. But I know that it will never go away, fully go away.
Yeah. Yeah. And first of all, I just love the way you describe things. I don't know if I've ever told you that, but like you just have this like poeticism I don't know if that's the right word, but it's beautiful. It's just a side note. It's just a compliment. It just, as a, I just wanted to say, but I think you brought up so many really important, relevant points. And I think one of them is the one that we talked about, is that we're not told that 18 years later that we will still be going for scans and that we will still be dealing with the fear of having cancer return. And I think that especially when you are a young cancer survivor, right? You were younger than me when you were diagnosed. But still we both fall under the, AYA category. Um, there's this, and when you're healthy, there's this idea that, well, yes, you might have had cancer, but you were healthy anyway, and you're young, so you will be fine no matter what, and you don't have to worry. But there's an unpredictability to cancer. I think people forget. It's like, I didn't think I would have cancer again a year later in a completely different type, right? Like, you didn't think you would have a rare cancer and an even rarer cancer, right? Same thing with me. I mean, I know chromophobe is not as rare as unclassified, but in the category renal cell carcinoma, it's rare. And so I love that analogy of like putting your hand into a bag and pulling out that one ball, because that's what cancer is, right? You can be told, yeah, your prognosis is 90%. But when you have an uncommon or rare cancer, it's like, what does that even really mean to you? Um, and yeah, so I don't know. I don't know what my question is there, because you said so many good things and so many really important things, but I think maybe just pulling on the thread of cancer's unpredictability and just what you were saying about that tinge over your life, where it's like, yeah, maybe it's not as dark the first few years, as it was the first few years, but it's still always following you like a shadow.
Yeah, I mean, I think that cancer is, I don't want to say special, but it's unique in
Mm-hmm.
that sense. I know that there are a lot of chronic diseases out there. There are a lot of autoimmune diseases that people are facing that are very real and very painful and terrible. But there's a reason why cancer is called the emperor of all maladies, right? There is
Mm-hmm.
that great book by that name by Dr. Mukherjee that I remember reading a few years ago, and it was, to me, it's the most horrific book that I have ever read
Yeah, I'm
because
looking on thrift books right now for that. So keep going. I'm just
it
gonna order
was
it.
it was incredibly triggering, and I think that the unpredictability of cancer is exactly right in the sense that no one can really explain to you why it happened in the first place. And given that I was dealing with kidney cancer, given that I had two kidneys, and like I was saying earlier, that what is stopping the cells in my left kidney from forgetting to multiply, from learning to stop multiplying. And so it really is, cancer for me is like that. I think it really just taps into our primal human instinct, that fear, that boogeyman under the bed,
Mm-hmm.
that that is not always rational, but it is very real. It's the shark and the still waters that people are afraid of, even if it's not rational. It really dismantles a sense of safety, a sense of a loss of innocence, especially, being as young as I was, an ability
Mm-hmm.
to know for a fact that yes, we are all mortal. Yes, I am mortal. But in terms of how I'm feeling, that I'm unable, I'm no longer able to keep the reality of my mortality at bay.
Mm-hmm.
Um, there is there is a poem by T.S. Eliot that I really love. And one of the lines that I latch on to, I think because of this, is I have seen the eternal footman hold my coat and snicker, and in short, I was afraid. And it's that fear that you have to walk into, that you have no choice but to walk into as someone who is dealing with cancer. You have to walk into the darkness, into the uncertainty, into the fear. And to some extent, if you want to maintain some level of well being, you have to embrace it and you have to learn to live with it and live alongside it. Um, so I don't know if that answers your question, but but it is something that even 18 years out, and I have people in my life who have told me, Raul, it's been long enough. Raul, don't worry about your scan. You're going to be okay. You're perfectly fine. And I appreciate where the words are coming from. But unless you have seen yourself on a precipice
Mm-hmm.
of staring at your own death in a real, visceral way, it's it's something that you cannot forget. It really changed me. It changed who I am, my identity, how I view life, how I approach people, how I approach the world. And I wouldn't be who I am or where I am, and in some ways without that experience. So yeah, it's that fear that people have that's not necessarily rational, but
Yeah.
that happens every now and then, like a shark attack or a plane falling from the skies. And no matter how low, and that's the thing, right? The odds of those things happening are quite low. But as I've been told by many doctors, I won the lottery of the cancer world.
Yeah.
And they say that in a way to be funny, but it is like, what am I supposed to do with that comment? What am I
Yeah.
supposed to do with that? And if it can happen despite the odds to me, then why can't it happen again, right? So
Yeah. Did you think you were going to get cancer in the first place?
right, and I think that what's different about cancer is that it's not something that you can pick up from the environment. I mean, yes, there are toxins and such
Yes.
that will affect our bodies, yes. But at the end of the day, it's still your cells
Mm-hmm.
multiplying and not stopping and creating tumors. It's you basically, right? Like
Yeah.
the cancer is your body, the cancer is your cells, the cancer is you. Um, so it's not some kind of external disease that you can get from being around someone else or touching someone else. It's your body at the cellular level that is unable to stop multiplying and is unable to stop growing, and it's putting this pressure on your system. And so if my cells produced cancer once, what's stopping my cells from producing cancer again? And
Yeah.
so I would even, for a long time, I saw my body as, I don't want to say broken, but I saw my body as ineffective
Mm-hmm.
in comparison to other bodies. Again, given that I was so young and had a rare cancer, my body at the cellular level could not get its act together. And I had experiences since then with other things unrelated to the cancer. But like for example, a couple of years after my diagnosis, I had a lymph node behind my ear on my right hand side that just started to like pop up a little bit, and it was
Mm-hmm.
inflamed, and it was just inflamed, and it wouldn't go away. And I ignored it for a little while because I just was tired of dealing with health matters. Eventually, I went in, and the first thing my doctor says was, well, given your history of cancer. And so again, and every little thing like that, every experience like that after a diagnosis, that when something aches inside your stomach or something doesn't feel quite right, that your mind cannot not go to cancer. Is it cancer? Is my body again unable to withhold itself like it did before? And going in and having the lymph node removed and then getting the biopsy and waiting for the results and being told, well, it's also on the same side as your cancer. So, I mean, theoretically, it could have spread if it's related. And just that alone is enough
Yeah.
to again feel like, okay, my body at the cellular level cannot get its act together.
Yeah.
And
Yeah.
so, yeah.
Yeah.
And so what can you do about that, right? We are bound to um, to the body that we have, and we can't always control what it does.
Yeah. No, I think that's the other thing that I don't know if um people who have not been impacted by cancer don't realize is that when it comes to your health, whether it's within the first year of your diagnosis or 5 years or 18 years, there's always going to be that, well, given that you've had cancer before, like not to get too gross, but I've been having digestive issues recently. And it's changed in the last like couple of months, probably from my nutrition, but still I'm having an issue. I went to my doctor, and we're the same age. We're both 41, and you don't get colonoscopies until you're 45. But she said to me, because I'm, obviously I'm concerned. I'm going to be concerned. Like my brain, we're like kind of the same, like my brain's going to go there. But she even said, she's like, well, given that you've had two different types of cancers at your age, you should probably get a colonoscopy before 45. Why don't you ask your oncologist? I asked my oncologist. He's like, yeah, I agree. You should probably get a colonoscopy sooner. And it's like, okay, the chance of me having colon cancer may not necessarily be high, or colorectal rectal cancer may not be high, but I have two doctors who are saying, hey, given that you are young and you had two different types of cancers within 2 years of each other, why don't you go check your colon? Because it might be something bad. And it's like, and so it's just, how are we supposed to handle that, right? Like, how are we supposed to go, we can be grateful, right? The dialectical thinking, we've talked about this before. You can be grateful and worried at the same time. But I think when it comes to survivorship care, and I think in general, I know there are people like out there and survivors who are doing a lot to build up survivorship care, but like onco survivorship care. But I think that's somewhere where, to be honest, we fail in the medical community, is providing that survivorship care after the treatment, after the first few years of surveillance. We go from treatment, surveillance, and then you're just supposed to be fine. But while in that period of you supposed to be fine, you're having these meetings with your doctors who are telling you, yeah, you should go to these tests because you had cancer before and it could be again. Like, that is the implication underneath all that, is that you could have cancer again. And it's like, I don't want to. Like, I don't want to. Can I just not? Like, how about we don't? How about we don't do this, right? So yeah, so I appreciate that you're coming on and like sharing this survivorship experience. It's like nearly 2 decades survivorship experience, because there's so much wrapped up into it that just does not end after your 5-year mark, right? And I'm sure there are other things that you've gone through, cancer aside, but like even the side effects of just having your kidney removed and all the stuff that 18 years later we're talking about, with not having the right information for your nephrologist, or conflicting advice. If you want to talk a little bit more about that.
Yeah, so there is the long-term survivorship in terms of the cancer, in terms of, what are the odds that it'll come back and all of that, and confronting something that's scary. But then there is what happens to your body in trying to cure your body of cancer. And I did not go through chemotherapy. I did not go through any kind of radiotherapy either. My doctors, I don't know what happens now for a kidney cancer patient, because this was 18 years ago. At the time, I think immunotherapy wasn't really a thing as much back then. I just remember my doctors at the time telling me that with kidney cancer, it's so deep into the body that chemotherapy doesn't have much of a benefit. And I remember for some time, I remember thinking, kind of feeling like a fake cancer survivor. And I'd be like,
Mm-hmm.
I had my kidney removed. That's basically what happened. Like,
Mm-hmm.
and yes, it was because of cancer, but I didn't go through chemotherapy. I didn't, to go through what one thinks of when one thinks of cancer, of like chemotherapy and losing your hair and things like that. So I kind of felt like a fake cancer survivor. But then when it comes to my body, and what the loss of the kidney did, there is that whole other aspect of it. And again, given that I was so young, I remember my doctors telling me, okay, you have one kidney left now. You're only 23 years old. You want your kidney to last you at least 50 years. Like, if we put a
Yeah.
time span of 73. Um, so you need to be very careful with your kidney. And another thing that my doctors could not explain is that while my remaining kidney did make up, it did grow in size,
Mm-hmm.
actually, according from looking at scans, which is what happens. It never fully made up for the loss of the right kidney. And so I am in for the last 18 years, I have had stage 2 chronic kidney disease. Stage 2 chronic kidney disease. I think my kidney is operating according to kidney function tests and how they're
Mm-hmm.
done today. separating at about 71%. And that is something else that has been hanging over me for the last 18 years in terms of my kidney health, being told, being warned actually by my nephrologist and urologist to be very careful with my sodium intake, to be very careful with my protein intake, being told to not consume more than 80 grams of protein a day because it's really bad for my kidney. Hearing from other doctors that no, there's really no impact on the kidney when it comes to protein. So again, getting conflicting information from specialists and doctors and wondering how do we not have more research to figure this out so that I'm not left confused, and really treating my body, seeing my body like a bit of something that can break if I put too much pressure on it, too much stress on it, and being very careful with it, not wanting to push it in any way because it's already under so much stress. And this is how I ended up coming to you, Anna Maria, because 15, 16 years later, I finally had enough of letting my cancer experience define what my body looked like. I am a naturally skinny guy, and consuming such low levels of protein and being really careful with my diet all of that was shaping my body to look a certain way. And when I started to really go in my intentional cancer healing journey with therapy and with really reflecting on what happened to me, which I thought when I was younger, I thought I was fine. That's, yes, I went through it, I'm fine. But when you're young, you tend to say that to yourself. And so I realized very early on that my healing journey is limited if I cannot change what my body looks like, because my body looks the way it does in large part because of the cancer. And so the cancer took away my sense of control over my body, my sense of having a say over what my body looks like and what it does, what it can do. And so that's when I started to say, you know what, I'm fed up with this. I'm going to try and find a way to work out and get bigger and build muscle. And for the first time in my life, I'm not going to care what that means for my kidney. Now, 6 months later, I go in for my kidney function test, and my doctor's like freaking out. What are you doing? What have you been doing? If we continue on this trend, we're going to have to put you on medication for the kidney disease. And that's when I came to you. But there really is that loss for me, that cancer took away my loss of control over my life in terms of my mortality, but also over my body in terms of the effects of having lost my kidney, having chronic kidney disease, and the things that I could do and eat or not eat. And it really leaves you it left me feeling like I had no say. And to try and take control has not been easy. It's required specialists and people who know how to go about doing this, such as yourself. But it really has been a part of my healing journey in a very, very meaningful way. It's easy to treat our bodies as completely aesthetic, it's completely all around aesthetics and superficial, but there is a lot to say about how we look impacts how we view ourselves. And I wanted to view myself as a healthy, strong man. And for a long time, I wasn't able to do that because of the loss of my kidney, because of the cancer. So there's also something that I'm still living with. I actually have a text message from my doctor telling me to go in for a protein in my urine check that I have to do. So I'm going to be dealing with that for the rest of my life. And on the one hand, and that's another thing about cancer that yes, it's a pain. Yes, it's something that I have to deal with and manage with, but at the same time, I have to maintain this, this sense of gratitude and appreciate that I even get to, right? Like, I have to go through these hardships while at the same time being grateful that I get to do that, because the alternative was death, right? The alternative was not surviving. And so it's this kind of weird place where you have to hold that weight, you have to carry that weight, I feel the pressure to be grateful that I get to hold it.
Yes. Yeah.
and then but it's kind of messed up in a way, right?
Yeah.
Because here, Raul, hold this for the rest of your life and be grateful that you get to hold it. And that is what cancer does. Cancer
Yes.
just doesn't make sense. Just nothing really makes sense after that, because I even find myself stripping my own experiences away of like, oh, I should be more grateful, or I should be able to get through this stressful thing more easily because I've had cancer. I know what an alternative
Mm-hmm.
life looks like.
Mm-hmm.
And always bringing that reference to that perspective, while good to have, it also, is unhealthy in terms of using it to try to lessen the experiences that I'm having that are very real and very valid. And so
Yeah.
finding that balance between allowing myself to be stressed and to be anxious about small things while maintaining the perspective of survivorship and the guilt of survivorship is actually really tricky. And that's another thing
Yes.
that I'm more mindful of and that I've been trying to manage and balance lately. But it's not always easy.
Yeah. And I think we just tend to or many of us intend to internalize other people's expectations on us of how we should actually act as a survivor. Because I deal with a lot, and we talked about this, I deal with a lot of the same kind of feelings and guilt of like, how do I balance? I should just be grateful. So I'm just going to compartmentalize everything I'm feeling because I was stage one, and therefore I need to be grateful because it could be worse, and therefore it wasn't worse. But even though I'm dealing with all these things. And a lot of people, like you were just saying, a lot of people feel that way, particularly when they're in the early stages of cancer. It's just, you have to, like you said, you have to hold that weight of gratitude. But I think we forget, or at least the people around us forget, that we're humans and we're complex and we're allowed to have multiple different emotions that compete for time. And it's more about how you balance and handle those emotions versus having those emotions in the first place, right? Um, but I wanted to, talking about just dealing with the after effects of having um, one kidney. I think one thing where we can probably, the kidney cancer community can improve is funding more of that like survivorship research, right? Because the one conversation we were having that you had with your doctor is that there isn't research for people like us, right? Like a lot of the research out there that is defining our health now, or the guidance that doctors give us now, are people with two kidneys who may or may not have had cancer, right? And so we're taking something that our bodies are not, right? And we're taking that research and applying it to our bodies that are completely different, especially people like in our situations where we're weightlifters and we're more athletic and we're more muscular, and we have that conversation too. And so that's just a general note. There's no question there. More so just to say, I think that, and maybe just get your action. I think there just needs to be more of that. Like, I think there needs to be more survivorship research. And I know that's not necessarily where the money is, but maybe we need to put money there, because like cancer doesn't end when the treatment does. That's just physically it might end possibly when the treatment does, but the whole actual experience does not end when our kidney is removed, because there are more long-term effects. And that causes, like, just thinking about when you're talking about in terms of the way your body and how you reviewed your body after your kidney was removed, and doctors telling you how you were supposed to treat your body and treat your remaining kidney. I mean, that's a side effect of it, right? Like that, and that has damage to or does damage to your mental health and emotional health and even your physical health. So yeah, like I said, not a question there, maybe just a reaction to what I said.
Yeah, it's no, I agree that there is conflicting information that, at this point I've lost count of how many I've moved around a lot, five
Yeah.
different cities or so. I'm now in London. And so seeing urologists in all these places and nephrologists and getting conflicting information and getting guidance from them, and from a lack of research. I know that there's even the and I would encourage listeners to please do your own research. This is just
Hmm.
based on the research that I have done. That the reason why nephrologists say do not consume more than, that protein is bad for your kidneys, is based on research that was done with stage 4 chronic kidney disease patients who were,
Hmm.
who were later on in life. And so and it was done in the 90s or quite a while ago. And so does this research, is it really applicable to a 23-year-old who has one kidney,
Yeah.
in terms of how much protein I was able to consume? And you referenced information that was shared with me by a doctor in London. And again, I encourage people to speak to your own doctors about this, but he is the one who made the point to me, for the first doctor to do so in 18 years, that how kidney function is measured is based entirely, that system is based on people with two kidneys. And so it's not based on people with only one kidney. And he has operated on 1,000 or so kidney cancer patients, and he's also a professor. And when they've done biopsies on people who only had one kidney, when they've biopsied their kidneys to check the kidney function, their kidney function is actually quite normal. It's not where the kidney function test, that again is based on people with two kidneys, was demonstrating. And so he told me that quite likely, we have to be our own doctors, and we have to follow our own trends and keep track of our trends in terms of our creatine levels and our kidney function levels. And if everything is stable, then that is the important thing. But he's the one who made the point to me for the first time in 18 years that quite possibly I may not have stage 2 chronic kidney disease, that my kidney function might actually be normal for someone with one kidney. And again, that was a second phase, or a second experience in this journey of mine, of feeling this weight released from my shoulders that I had been carrying around my kidney health. And I'm only one stage away in the chronic kidney disease world from needing medication, and then only one stage away from needing dialysis and all these different things. And so again, this just really calling more, especially as we have more and more survivors of kidney cancer, which we are having more and more, then I agree that it's more important to do research as well into people with one kidney and what kidney health looks like down the line for them, because right now it really has affected my well-being in a lot of ways, and how I approach my body and think about my body, because it's been compared to people with two kidneys, not to people with one kidney.
Yeah. And for me, similarly, when, the first year or so was really hard because I was following one, I had a terrible nephrologist who I do not see anymore, but I had this nephrologist who didn't give me any information or explain anything to me. And then you had my urologist was great. Like, he was the one who explained to me, because you're muscular, your creatinine is going to be higher, because this is what, this is how muscle affects creatinine. And it's like a snapshot in time. So this is your baseline. So you're actually pretty okay. But then I had a nephrologist who was like, no, you are like stage 3. This is what this is. And I'm like, yeah, but I mean, everything else is okay. And doing my own research, and putting all my effort into getting that research out to other people and making sure I understood it. I think it helped release. It was a release, and it made me feel better. And now I'm able to pay attention to what I need to pay attention to, so it feels good for me, versus oh, this is what I'm told I am supposed to do. And I think, again, there needs just to be more research done, because you're right, there are more survivors. There are going to be more people diagnosed, but there are also more survivors, and they're getting younger and they're living longer, despite what previous research said. So I know this is me just getting on my soapbox about it, but there just needs to be more effort into that, to that survivorship care, and really understanding and seeing what long-term survivorship looks like. And so I appreciate you sharing your story. We do have 5 minutes. So any last thoughts that you want to share that maybe I had not touched on?
I just had a thought as you were speaking. Well, I was going to say as well that when it comes to kidney health and kidney function, something that is not always considered, that you and I have talked about, is body type. I have my doctor in London. I have not actually seen her in person, because a lot of it is done remotely. And I went in for kidney function tests, and she messaged me. She texted me after getting results to tell me that I need to go on medication for kidney disease. She's never met me in person. She doesn't know how tall I am. She doesn't know if I'm muscular or not. All these different things that affect kidney function. And so understanding our own bodies as well and considering that is really important. And I have another doctor that I saw afterwards who actually took my kidney function and then somehow applied things like my body type and my weight and the fact that I take creatine because I lift, and then from there he computed a more appropriate, more adequate kidney function marker that was not scary at all, right, and was consistent with where I've been. So just all of that to say that we need to be our own. We need to be know these things and be aware of them, and not just let doctors tell us where we are in terms of our kidney health and kidney function. And I only think about the people who don't have the resources, the time, the education, the knowledge to be able to do that for themselves. And I wonder what they're being told by doctors that they're just embracing and absorbing because the doctors are the experts. And so we also need some kind of educational outreach for people to understand these things. But I just want to say in the last few minutes as well that there are three people that I think about from time to time, and I would love to share their names with our listeners.
Yes.
These were friends of mine at some point in my life, all of whom sadly passed away from cancer before they even made it to 30. And when I go in for a test, talking about survivor's guilt, when I go in for a test or a scan and I'm feeling the stress of it, I think to myself, Raul, think about Crystal, who died at 25 of cervical cancer, a friend of mine from high school. Erika, who died at 29 of leukemia, a friend from grad school, and Naomi, who died at 29 of brain cancer, a friend from college. I think about them and how much they would wish to be in my shoes, to be going in for a scan at 18 years. And again, I carry them with me and I'm grateful. But of course, there's also an element of survivor's guilt in this.
Yes.
And it's that complexity of feelings that we have to carry as survivors, and appreciating life and being grateful for it, but remembering that there are people going through it now. And there are people who are not with us, sadly, because they did not get a chance to call themselves survivors. And so it's just all part of the cancer experience and what it does to us and how it shapes us. And so yeah, I just wanted to mention their names because I carry them with me for good and for the guilt that comes with being a cancer survivor. But yeah.
Well, thank you for honoring them and using the space to honor them. And it's important for us to keep those people who have touched us close to our heart and to carry with them. But to also know that our stories, not to say that you're doing this, but just for the listeners, it's like we should hold those people close to our heart, but we should also honor our own stories. And I understand survivor guilt very well. So I think we can all do better at honoring our own stories. But thank you for using the space to share theirs and for talking with me and having this wonderful conversation. For the listeners, I am Raul's fitness and nutrition coach, which is how we got to know each other. I think I implied that, but I didn't say it explicitly. So we are close, and I get to tell him what to do with his food and his body. So that's always fun. But thank you again for joining me and chatting with me. It was a pleasure.
No, thank you for the space. It's been a pleasure. This is the first time that I share my experience in such a public way. So thank you for allowing this to be a part of that journey of healing and like you said, honoring my experience and giving it the space that it deserves.